All right, guys, how are you? I hope everybody's having a good day. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to talk about what not to do with back pain. I think it is important to understand what you don't do a lot of times is as important as what you do. And this video may not be exactly what you think it is, because so many times when we get injured or we get hurt or we feel pain, we stop moving. And that's really the antithesis of what you should do. You should not stop moving. So many times people with back pain will get back spasms and just go flat on the couch for an entire day. And really that's one of the worst things you can do, is to stop moving. Now, I don't recommend going and running a marathon, but we really see a lot of people who come in and say, you know what, I was really sore and then I laid down on the couch and it doesn't ever get really back to normal, but I guess the pain subsides enough that you can get off the couch. So one of the things that you don't want to do is you don't want to stop moving. Actually, gentle movement can really help back pain, and moving and getting that blood flowing. And this is just a simple walk. This can be just sitting and standing from a chair. Keeping that gentle motion will help. What you do when you sit down or you lay down and you stop all your motion is you allow that muscle to compensate. You allow that muscle to heal itself, so to speak. And it doesn't ever heal itself correctly, it just compensates. So while you may feel better for that time being, it's going to come back with a vengeance. A lot of low back pain that we see here has had 6, 8, 10 months prior to coming in to see us, bouts of back pain. Oh, it hurt, and then I laid down. Oh, I hurt, I took Advil. You're going to see that escalate. So while you might hurt your back one time and then you take Advil and it goes away, the next time you may have to lay on your back because you can't move. And then the next time, you take off work because it gets worse and worse and worse. So understand that chronic back pain and people who suffer with long-term back pain, a lot of it doesn't come from a severe accident, and it really only comes from this ignoring it and laying down repeatedly and not really addressing why you have it. Laying down and stopping movement is not going to solve anything. It's going to allow the pain to go away in the moment, which I get, you absolutely want to do, but it really is detrimental for your long-term health. And when it comes back again, and this time laying down doesn't even help, you can't get comfortable, you can't sleep, you can't do anything, or that pain's shooting down your legs now, that's when the compensation and the back pain gets a little bit more severe and less manageable. So when I say what you don't want to do with back pain is you don't want to stop moving. Now, that leads me to what do you do? Because you don't want to go out and run a marathon. You're in pain. You could be in spasms to the point where you have to stop. But what are some of the things that you can do when you have back pain? So let's say you have spasms when you're standing up, and I'm going to show you a couple things that you can do. What you want to do first of all is you want to really try and just get a little bit of motion into that low back. So if you're able to, you want to just have a seat, nice and easy. This is nothing crazy, okay? And you want to actually slump down in your chair, and then you want to sit back up. Nice and easy. Now this is called what we would do a cat camel. This is a different variation of it. It's a little bit harder on your back because you are sitting, but if you're in active spasms or it's really painful, you want to make sure that you are continuing to gently move the back. Now, if you go into this flexed posture and you start to feel numbness and tingling, or you start to feel any sort of issues, you want to stop. Obviously, this is not something that you want to do, but you can use your hands for support. You can do this also in standing, where you're just kind of doing a little bit of crunch in a stand, and then coming back up and sticking your butt out, and then going into a crunch. Nice and easy. You can do this while you're in the shower. So if you're someone that wakes up and your low back is really tight and you feel stiff, a lot of times I won't hear pain described as pain right away. It's always stiffness that it starts out with, then it becomes pain. But if you're someone that wakes up with that stiff lower back, you can really just stand there in the shower and do a little bit of tucking and then sticking your butt out and tucking. You want to go nice and easy. All the movements that you do when you have low back pain and it's active and it's killing you are gentle. So don't overdo it. It's not a race. It's not anything, no pain, no gain. It is just a simple movement. And maybe as you start to move, you're just gently moving here to here. It's a small movement. all right? But just make sure that you continue that movement. The next thing that you want to do, and again, there are variations that you can do of this. If you can't sit, if you can't stand, if you can't lay down, this is just simply bringing your knee up to your chest. Now maybe you're here. Maybe you can't sit down, and maybe you try and lift your knee up, okay? Maybe you put your foot on a step and you do this way, okay? But again, it's this gentle motion to the low back. Maybe you lay down and bring your knees up one at a time. Maybe you're here, okay? It's this gentle motion that I'm talking about, all right? Allowing that low back to move. Now, obviously, if you're in pain, you don't want your head and neck to be up. I'm just demonstrating some things, but you would just lay here and gently move your leg and then switch to the other one. Now, let's say you get here and it hurts, then just put it back down, all right? But you want to gently move your leg if you can get all the way up. Now, if you're not in active spasms, but you wake up and your back's really sore, you can do a couple of these before you even get out of bed. Nice and slow, bring it all the way to the chest, all right? I recommend, if you can, if it's not really painful, to bring both of them up to your chest and then back down. That's a really great way to kind of start your day if your back is sore. The final thing I'm going to show you is a little bit more advanced, but it's one of those things that I always recommend for anything, basically, your back, hip, or whatever, but it's a great stretch to get into the habit of doing. It's this figure 4 stretch. So I've shown it standing up, I've shown it sitting down, we're going to review it sitting down, but this is a really good one to do because it's going to allow your hips and your back to open up. So when you're at home and you have not been properly diagnosed, you have not sought out medical treatment, and you don't know if it's coming from your hips or your back or where is it, this is a great one to just open everything up gently. So again, you're just going to start here. Try and get your ankle up onto your knee if you can, and if that hurts, then back off a little bit and you start here. But you want to bring your ankle up to your knee. If you feel a stretch here, this is where you stop. Some of you it may look like this as you bring it up because your knee doesn't go down that far. You may just be doing this, and that's okay too. Again, it's a slow, gentle movement. If you don't feel a stretch sitting here, then you can sit up nice and straight, and then you can start to lean forward. This is not leaning forward. This is actually causing you back pain. Hinging from the hips and leaning forward until you feel the stretch. That's where you're going to feel it. You can sit like this in your office chair and get a good stretch. You can sit like this for a couple minutes and allow gravity to do work on that knee. But the main thing is, when you have low back pain, you don't want to stop moving. You don't want to lay flat. You don't want to take Advil and just stop. You don't want to put on some sort of icy patch, whatever they're selling now, I don't know, and just stop moving. That can cause severe issues down the line. I've seen it more than 100 times. It is not something that you want to do. Walking, going in the pool, any of those light activities are going to help you in the long run. It's going to help your back relax, and it's going to help you recover quicker. If you have these types of symptoms, though, and you have low back pain, and you know when the last time you had back pain was, you need to be seeking medical treatment, okay? This is not something that's going to go away on its own. I understand popping a few Advil, putting on a heat pack, and all of a sudden for today it's gone. It's going to come back. So the quicker you deal with it, the quicker you get in to see somebody, the quicker it's going to be resolved. People say, I spent too much time in therapy. Well, if you had come into therapy, right when it happened, it takes far less time. So the longer you procrastinate, the longer you try and treat this on your own, and Advil and heat are treating it on your own, the longer and the harder it's going to be to reverse the effects of what you're doing. So if you have low back pain, nice and easy movement is the best thing that you can do. If you or someone you know is suffering from low back pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.